At the beginning of this year, we have started kicking off our meetings with an update from Cobb Douglas Public Health regarding the COVID-19 pandemic. Hi, Lisa.
Thank you so much, Chairwoman Cupid. I'm happy to be here tonight. I am going to be presenting tonight. Dr. Memark is not able to join us. She had another commitment. And so I've asked Dr. David Jackson to join us because I am not a physician and don't play one on TV. And always want to make sure that if you all have medical questions that we've got the experts available to answer those. Dr. Jackson is a board certified physician. He's a preventive medicine resident fellow on loan to us this past year from the CDC. So he's been a tremendous asset to us this whole pandemic and is more than qualified to answer any of your medical questions that you may have that come up tonight.
Great.
So I just want to hit a few of the highlights from the data for you. I'm sure that by now most of you are looking at this and can interpret this on your own, but just want to keep you updated. So when we were together a couple of weeks ago, our total positive case rate, 2-week case rate, was at about 225. Yesterday it was 212 per 100,000 residents. Just looked at it a minute ago and it was down to 207. So it's certainly going in the right direction. We are not out of the high spread yet, and our decline has slowed, but I will tell you that we're excited because we were worried that we might have a bit of a bump because of spring break and Easter holidays, but it looks like we may have dodged a bullet on that. So that's good news. Our positivity rate is at 4.2%. Again, it has been coming down on a slight decline. If you'll remember early in the pandemic, we talked that we wanted to see this below 5% on a regular basis. So we've been holding at about 4.2 to 4.8 the last few weeks. So that's good news. Lower's always better, but we're happy with this percentage. We are also, we look at about 15 different metrics every day on this. And so one of them that we do look at that's the saddest is the number of people that we have lost during this pandemic. In the last 2 weeks, we've lost about 25 more residents to COVID. And so that's devastating. And if you're one of their family members, our heart goes out to you. From a pandemic standpoint, we are pleased that this rate seems to be declining and that we're not seeing the spikes that we saw right after the Christmas and winter holidays. So we're at about 1,035 residents that we've lost to this virus. And again, our heart goes out to all of those family members. I do want to mention, while I've got this slide up, that we've given some information out to put out on the Cobb County website, and it's on our public health website, that FEMA just came out, I believe it was last week, with an application opportunity for family members who have had funeral expenses this past year, with a very reasonable application to be able to help get FEMA to support and cover some of those funeral expenses for our residents. So we'll again make sure that that's available through the Cobb County government website if there are family members who would like to apply. I believe that goes back to mid last year, if I'm not mistaken. Dr. Jackson, do you remember that date?
I think that's right. It may even go back further, but it may go back closer to the start of the pandemic, but we'd have to verify. So,
thank you. So that could be an opportunity. It's certainly not going to bring the loved ones back, but it might help the family with some of the financial burdens.
Certainly.
Wanted to give you an update about the variants. This is a busy slide, and I'm not going to go through all the details. I will just bring your attention to this light peach color. The B117 or the UK variant. You can see that from the middle of January, where this first column is, all the way through the end of March, how the volume of the B117 variant has increased. And as of this slide, it was covering about 44% of all the variants were the B117 or the UK variant. I was on a DHD call today, a state call, where our state epidemiologist said that Georgia now has 64% of all the variant cases are now the B117 variant. So again, remember that our concern for this is that, one, we think that these variants, at least this one, is more contagious, but the jury's still out about whether it is more deadly. Dr. Jackson, anything you want to add there on the variants? You've been tracking those a little better.
Thanks, Lisa. It's continuing to see that uptick, especially in that B117 variant. This is the one that you may have heard about is called the UK variant, as it was first identified there, but has really spread rapidly across the country, and no exception here in Georgia. As Lisa noted, it tends to spread more easily, and there have been some studies that have indicated or suggested that it may be more deadly as well. We're trying to keep close tabs on these, and this virus, at least for this particular variant, the vaccines still appear to be protective against this particular variant, but particularly the so-called South African variant is of bigger concern, but that one has not spread as widely as this UK variant, the B117.
Thank you, Dr. Jackson. So just kind of in summary, remember that we're still in high spread, that even 212 or now 207 today is still considered high, because anything over 100 cases per 100,000 residents is in the high category. But we are certainly encouraged by the reducing positivity rate and the continued downward trend. We do ask that residents continue to get tested if they have symptoms or if they're identified as a direct contact. And just a reminder to everybody, our epidemiology staff is still investigating outbreaks, still doing case investigations, and still doing contact tracing very robustly. We've had a couple of outbreaks this week that they've been looking into. So it hasn't gone away yet. So we ask folks to still be diligent. If you need to get tested, a reminder that we still have the free PCR testing at Jim Miller Park through our Mako lab partner. An appointment is not required, but you do just need to register in advance. And their turnaround has been very quick. Other retail locations are continuing to do PCR and antigen testing. And then just a reminder that where we had satellite testings with sites with our core partners, this week we finished converting those testing sites to vaccination sites to increase access around the county. So let's turn our attention to vaccinations a little bit and talk about that, because I think that's where there is the most interest. So keep in mind that about 2 weeks ago, or since 2 weeks ago, we've vaccinated about 1.1 million people more than we had when we last met. So we're now at almost 5.9 million people in Georgia are vaccinated. We have 34% of our residents across the state have at least one dose, and 24% have been fully vaccinated. That's up from 17% 2 weeks ago that were fully vaccinated. So making some nice progress very quickly, but it is just not as fast as we want it to be. In Cobb County, I wanted to bring your attention there. We have administered about 350,000 vaccinations. Of our Cobb County residents, 26% have at least one dose, and 21% are fully vaccinated. That's up from 16% just 2 weeks ago. So we're making nice progress there. You can always get this information off the DPH website. It's updated daily as well, just like the testing information is updated. I wanted to just bring your attention quickly to some of the folks and a little bit of the breakdown about who's getting vaccinated. So this top chart that you see, this bar graph, is a breakdown of what percent of Cobb County residents in these different age groups have at least one dose. And so you can see that our 65-year-olds and older have done a great job getting vaccinated, or at least getting one dose. That's not surprising, right? Because they were eligible a lot earlier than any of the other age groups. So we would expect that. We do also see down here in this bottom pie chart and the bar graph, you can see that The majority of doses are being taken or being given in our white population. We also see that if you look at the percent of the population in Cobb County with at least one dose by race, you can see the breakdown. And so we feel like we need to focus our attention on individuals who are 55 years of age and younger, our Black population of all ages, and then our Hispanic Latino residents of all ages. They are also tracking lower on vaccine usage than our non-Hispanic Latino residents. And I'll talk to you a little bit about how public health is trying to update or trying to reach some of those residents in just a minute. Great news today, breaking news today, CDC released some new outdoor mask guidelines. I'm excited about how CDC has very methodically been releasing guidelines for those who are vaccinated as we have seen more science come to be available. And so, you know, we kind of started out with grandparents who were vaccinated could visit with their children and their grandchildren without having to wear masks. Then we went to folks who were vaccinated, did not have to quarantine or isolate if they were exposed to someone who was a positive case. And now the outdoor mask guidelines have been relaxed. So you can see that folks who are fully vaccinated have a lot more leeway to be able to be outside, to be in small gatherings, to dine outside with folks without wearing their masks. We still want vaccinated folks, if they're in a large outdoor event, like a sports event or a concert or live performance, that they would still wear their masks. Dr. Jackson, anything you want to add there?
No, this is great news. You know, continued data that has emphasized the safety, especially for those who are fully vaccinated, which again would refer to those who are 2 weeks or more out from a single dose Johnson & Johnson vaccine or 2 weeks or more out from the second dose of their Moderna or Pfizer vaccine. You know, the data is really clear that it seems safe for these individuals to, you know, be outdoors without a mask because the risk of transmission in those individuals is so low. Just really great news of the high level of effectiveness of these vaccines, which is just a tremendous added tool for us.
I agree. This weekend, I was able to eat outside with a group of people who have been friends of mine for 30 years. Everybody was vaccinated, and we felt like we ought to start taking pictures because it was the first time in a year that we'd been able to be together without being masked or being really far apart from each other. So it is very liberating to be able to see some of these guidelines start to relax. So just wanted to give you an update. The last time we met, there was, I think Johnson & Johnson had just paused the use. And so just a reminder, and wanted to give you an update about the Johnson & Johnson vaccine. So recall that back on April 13th, the CDC and the FDA recommended pausing the use of the Janssen vaccine or the Johnson & Johnson in the United States because 6 people had reported rare blood clots, among them almost 7 million recipients in the U.S. So they paused it. They wanted to do a deeper dive on those 6 reported situations, cases. And so then on April 23rd, the ACIP met, and after doing a deep dive on the data, they concluded that the benefits of resuming the J&J COVID vaccinations among individuals 18 years of age and older outweighed the risk, and they reaffirmed the use of that vaccine. They did add that they wanted to include a new warning about this rare clotting event, particularly for women 18 to 49 years of age. And so on the 23rd, folks resumed the use of J&J vaccine across the country, and education or change was added on the information about this blood clot risk. I will tell you that in Cobb County, we have a number of folks who use all 3 of the vaccine types or brands, and they're going to be resuming J&J vaccine use now. Cobb and Douglas Public Health also uses all 3 vaccinations or vaccine types. And so we've just decided that as we are doing the different outreach events, we will make it available as to what vaccine we're using. And so if individuals choose to prefer one or another vaccine, they can do that by the event that they choose to participate in. Dr. Jackson, anything you want to add here?
No, just to say this is really a triumph, as some of you may have heard me say, for our safety monitoring system, that we were able to capture or identify 6 cases out of those 7 million doses that had been administered of this vaccine. And so I think it should really be such a reassuring sign to all of us and the public that our safety monitoring systems are so robust to be able to capture these types of events to continue keeping all of us safe as we move forward with vaccination efforts.
Agreed. Thank you. Just a reminder that in Georgia, everyone 16 years of age and older is eligible to get vaccinated. Remember that the Pfizer vaccine is currently the only one that is authorized for individuals 16 and 17 years of age. Also remember that individuals under the age of 18 need to have parental consent or legal guardian consent for vaccination. We do expect that the FDA is going to review the application from Pfizer to be able to use their vaccine for 12 to 15-year-olds within the next 4 to 6 weeks. I won't be surprised if that comes out sometime mid to late May that allows that vaccination option for folks. So more to come on that. We have tried as hard as we can to make it easy for folks to find an appointment or know where they can get vaccinated. We are no longer in the situation where we've got vaccine limitations. A lot of providers have vaccine. So if you go to cobbanddouglaspublichealth.org, you can link to retail pharmacies, all of the public health locations across the state, and also the Georgia Emergency Management Association sites across the state. So all of these links are available on our website. Also want to remind folks that if you have trouble, if you know someone who has trouble navigating a website or making the appointments online, that the Cobb County government folks have come to our rescue and launched this Cobb County call center, 833-974-3366. And folks are there to answer questions, but also to help make appointments. And they're available both through the website, you can see that, or on that phone number. Just want to give you an update about Jim Miller Park. This is also kind of breaking news. We've done almost 60,000 vaccinations to date at this location. We've been opening up about 7,000 new appointments every week over the last few weeks. I will tell you that in the last week and a half that we've had about 100 to 250 appointments daily that are being left unscheduled at this time. So we have just this week changed to where we are accepting folks at this location with no appointment when possible. I have to say when possible because if for some reason we get slammed, we don't want folks waiting for 2 or 3 hours in line, but we are accepting walk-ups and drive-ups at this location. So more information is on our website or through the call center. And then we just today have made the decision about a planned transition out of Jim Miller Park. I know that our fair fans and some of the event fans are cheering at this announcement. We feel like with the declining demand for mass vaccination, that it is the time to start planning for that. That's not something we can turn off very quickly. Like that we couldn't decide to do it next week. We really have to plan far in advance to be able to do that because of the way appointments are built. And so beginning May 17th, so about 4 weeks from now or so, we will be changing our schedule at Jim Miller Park to only offer vaccinations at this location Wednesday through Friday, 8 a.m. to 1 p.m., and Saturdays, 8 a.m. to 11 a.m. We will be closed for vaccinations on Mondays and Tuesdays. At that same time, we will start to transition our staff and our vaccination services to each Cobb and Douglas Public Health Clinic. And we will continue to provide vaccinations, COVID vaccinations indefinitely at our clinic sites. But we'll start to make that transition in May. And then our last vaccination day at Jim Miller Park is planned. Dr. Memark wants me to make sure to say that this is planned, because remember last summer we had a terrible spike in cases and issues. And so we are hoping that that doesn't happen and that folks continue to do the positive efforts of getting vaccinated and following the 3 W's. But it is our hope to have our last day of mass vaccination at Jim Miller Park on June 19th. It's going to take us a little while to clean up that area and pack up everything, and so then we would be fully out on June 30th. But we would continue to do the free Mako testing at Jim Miller Park as long as we weren't in the way of various events. If we would suspend testing on the days that we were at various events. We'll continue to do really robust outreach vaccination events. Again, due to our efforts and our partnerships with different folks like our Wellstar Health System and Northside and Pools Pharmacy, we're going to continue to do some outreach vaccination events. We appreciate the Community Development Block Grant funding that provided our mobile health van. And so we don't see that ending and that outreach effort ending for at least 6 months. So we'll continue to do that. This is just an example for you of some of the different locations where we're going to be in May. You can see that we're really trying to assure non-traditional hours, evening times, weekends, Saturdays and Sundays both, and to reach some of our more vulnerable residents across the county who might not be able to get to the mass sites. If you are interested in having us come out to a location, then if you can respond to us via our website, or you can call the Cobb County Call Center, and we'll evaluate and try and get in contact with you to schedule these events. But we're continuing to do really robust outreach with Wellstar. We've converted our core testing locations to vaccination sites across the county. So you can see that we're up at KSU and down at Epicenter and over at St. Thomas the Apostle Catholic Church. We're continuing to support our Georgia Department of Public Health staff and going to some of our larger employers to be able to vaccinate their employees. And then this week, we're excited and hopeful that we're going to be launching our vaccination efforts for some of our homebound residents in partnership with Pools Pharmacy and our Air National Guard folks. More to come about that, but we have right now about 100 residents on that list that we're going to be serving in their home through this partnership. And then I'm excited, and hats off to the Braves and to Northside Hospital. They've been working to develop a big event for Truist Park. So this Saturday, May 1st, they are offering to vaccinate up to 5,000 of our community members. Any Georgian age 16 and above can come to this event over at Truist Park. They're going to be using Pfizer, and then they'll be back in 4 weeks on the 26th. So there's more information on the Cobb County government website and also through the Braves and Northside and through Cobb and Douglas Public Health about this event. So just kind of to summarize, please don't relax your prevention practices. We're still in a high spread state. We still are watching these variants, so please continue when you're out in public and in larger groups to wear your mask, watch your distance, and wash your hands. Vaccine supply is now plentiful, so please get vaccinated. Many providers across Cobb County now have appointments available or are doing walk-ups. Please make sure to review the new CDC guidelines about outdoor masks and some travel updates that they've done. And then please visit Truist Park this Saturday for a vaccination, and then spend time at the Battery. What a better way to get vaccinated and then enjoy the time outside and support some of our businesses in Cobb County.
Right.
So I will end there.
Great. Thank you, Lisa, for that thorough and informative update.